Deputy Secretary General of ASEAN for ASEAN Socio-Cultural Community. He will deliver a keynote address on living with COVID-19. Your Excellency, the floor is yours.
Thank you very much. His Excellency Dr. Amin Liu Abdullah, Minister at Prime Minister Office and Minister of Finance and Economy, Brunei Darussalam. His Excellency Dr. Isham bin Jafar, Minister of Health, Brunei Darussalam. Excellencies of Economic, Finance and Public Health sectors of ASEAN member state, distinguished keynote speakers and all participants. Foremost, I would like to congratulate Brunei Darussalam, especially the Ministry of Health, Finance and Economies, as well as the partner organizers, EVYD, Knowledge Hub and Temasek Foundation, for the conduct of this special ministerial conference for ASEAN Digital Public Health. It is indeed a very sound, timely and well-organized event. Various input from experts from ASEAN member state, dialogue and development partners, academic and research institution made the session very productive as they are charged with ideas that are vital to ASEAN in leveling off the understanding on key and cross-cutting public health emergency issues. More importantly, in thinking about the future of ASEAN in improving our approaches towards building regional resilience and recovery. On this, allow us to acknowledge first the substantial changes across the different sessions, especially on the use of digital technologies, as they are useful for enhancing health systems and regional cooperations with relevant stakeholders. Second, the sharing of health technology-related updates as well as evidence-based information to assess public health risk, to continuously inform policy development at the national and regional levels, and to promote cooperation toward regaining robust economies. Third, the utilization of vital research and development and exploring innovative or out-of-the-box initiatives to responding to public health threats and emergencies, and further knowledge. First, that the results of the meeting can be shared with relevant sectors in ASEAN and with external partners to maximize and harmonize cooperation in addressing public health emergency through the leadership of Brunei Darussalam. ASEAN has enabling policies and programs in responding to COVID-19 and other health threats with multifactorial effects. ASEAN as a regional entity reacted early, swiftly, appropriately, and collectively in 2020 to address the regional needs through different sectoral bodies and partners across the ASEAN pillars. To date, ASEAN, under the guidance and leadership of the ASEAN Coordinating Council Working Group on Public Health Emergency, has key initiatives, among others, such as the ASEAN Comprehensive Recovery Framework and its implementation plan, the COVID-19 ASEAN Response Fund, the ASEAN Strategic Framework for Public Health Emergencies, the ASEAN Travel Corridor Arrangement Framework, the ASEAN Regional Reserve for Medical Supplies, and the Consolidated Strategies on the 4IR. The upcoming ASEAN Strategic and Holistic Initiative to link ASEAN responses to emergencies and disasters, and as soon as the operationalization of the ASEAN Center for Public Health, Emergency and Emerging Diseases. Additionally, in terms of sectoral work plans, digital health technology is a priority of the ASEAN health sector for 2021-2025 under the ASEAN Health Cluster 3 on enhancing health systems and access to care. Digital technology is also a priority in other relevant sectors under the ASEAN Socio-Economic and ASEAN Economic Community pillars. While this is so, it is also acknowledged that there's room for new ideas, new strategies to improve the relevance and effectiveness of present policies and intervention in ASEAN member state. And in ASEAN as COVID-19 is continuously evolving. This message is compellingly echoed in this event. One lesson that we have embraced and still adapting as we are living with the challenges of the pandemic is that we need to be nimble and flexible with our COVID-19 policy and program approaches at the national and regional level that is proactive to the needs of the people of ASEAN. At the regional level, policy, framework, and guidelines on responding to COVID-19 serve as takeoff points for innovations and creativity, for proactiveness in solution for the people, not for politics. Excellencies, distinguished delegates, considering the information exchanges on this topic, allow me to also share my humble 5 points on some way forward in terms of digital public health and how it relates to enhancing health systems and resilience, to reopening economies and communities safely, and to supporting and sustaining health service delivery during this pandemic time. First, the pandemic has been showing us that allocating funds to address the health need of ASEAN population must also evolve like the virus. The pandemic has been providing us with opportunity to transform our perspective from merely budgeting for health to investing in health to meet the needs of our people. From my point of view, this paradigm highlights that investment of a valuable return that can be calculated and measured compared to the act of budgeting that may basically focus on the allocation of funds for costs or expenses. Second, investing on universal health coverage in normal and beyond normal, such as pandemic times, is critical to building health system resilience by supporting essential public health function, especially in the recovery phase. The promotion of UHC involves sustained financing, addressing gaps in service delivery, including health workers, hospitals and other health facilities, and access to medicines, harnessing the private sector's engagement and utilizing digital technologies. Investment on digital health technology should be integrated into UHC to emphasize its utility in the health systems and to ensure the sustainability of its application. Third, inclusive digital transformation momentum should also be maintained, not only in the context of business and the economy, but also in healthcare delivery and health education. As presented earlier, the disruption caused by COVID-19 in the delivery of health services provided an opportunity for the promotion of digital application of technology in health, such as telehealth or telemedicines. In this case, healthcare workers are intrinsically essential to the use of these digital applications. In this regard, and my fourth point is creating a future-ready workforce by training and upskilling them, as well as developing the ecosystem to promote the use of digital tools to improve the delivery of health services, surveillance, contact tracing, and testing is a vital step to address public health threats and emergencies. In preparing for future outbreak and pandemic, increasing capacities of healthcare workers, such as epidemiologists, and digital and big data solutions are increasingly necessary. Fifth, utilizations of appropriate national and regional policies and regulatory framework to ensure continuous innovations and improve access in digitalization is essential. To enable this innovative digital responses to manage the pandemic and recover better, ASEAN will need to bridge the growing digital divide within the national, regional, and global communities. And in so doing, as what we have learned in the previous discussions, that cost, cooperation, creativity, trust, standardization, reaching out to marginalized population, and having meaningful interoperability are essential considerations. The application of digital technology is far-reaching. It's not only important to increase access health services or for surveillance purposes, but it is also important to ensure the agility of supply chain during a pandemic, as in the case of PPE, vaccines, and other pharmaceuticals. Sixth, and the last, is on the involvement of youth in the overall response to COVID-19 to prepare for future outbreaks or pandemics. In the current situation, the youth can be providers of services and health advocates in the communities. The youth should also be encouraged to participate in promoting health literacy and to contain misinformation that is adversely impacting on efforts to contain the infection in many communities, such as using digital platform and social media to engage young people on the issue of safety and health at work. To learn to live with COVID-19 and its variant is compelling us to be smarter than the virus, to be innovative and to think out of the box. Apart from public health and social measure, we do need to take advantage of the opportunity that is presented to us, the use of digital technologies, and how to maximize it in preparing for the next outbreak of pandemics, such as in enhancing regional sharing of surveillance data, in operationalizing travel corridors, in supporting startup organizations as partner of government in providing health services, as in the case of telemedicines and online pharmacies, to name a few. Though several challenges were presented in the conference discussions, this also provides us another opportunity to sit around the table to take stock and harness cross-sectoral and cross-pillar engagement on digital technologies and public health. This conference put together various stakeholders in finance, economies, health and science and technology to level of understanding deepen learning, and to prepare to be able to harmonize priorities across vital sectors that are essential in addressing the challenges brought about by the COVID-19. The ASEAN, the Imperative Advantage for Collective Mobilizations Action, it has the enabling policy framework, governance platforms, and actionable strategies that can serve as take-up point to further support cross-sectoral dialogue and to support cooperation in enhancing digital public health that is aligned with regional dictum as one ASEAN, one respond. On this note, I again would like to congratulate ASEAN Chair Brunei Darussalam for a successful and productive conference, and I look forward to more recommendation and insight from the expert during this conference. Thank you very much.
Thank you very much for the keynote address, Your Excellency. We have collected a few questions for Dr. Kung. The first question is, with the disparity of income, education, and healthcare provision within ASEAN, the new normal might be experienced differently for different people. How can we ensure that no one is left behind in this new normal?
Thank you very much for the questions. Actually, the issue of inequality is happening even before the pandemic. For example, in education, we still see a large numbers of our young people still cannot access to the high quality educations. Now, with the COVID-19, we moved the delivery of education to the online platform. We use the digital devices, the technologies, in providing all of those education to our young people. It's not just about all of this facility and technologies. We need an entire ecosystem to support it. And we don't have that yet, at least for some of our member states, or at least, for a large group of people. So what we are facing is another, major challenge in terms of making sure that, being able to access to all of this high quality services, whether it's education, healthcare, and all that, is going to be some things that ASEAN need to address, as part of our recovery framework. So what I can say is that if you look at the key documents that we put out, to support ASEAN member state in recovering from this pandemic, there's a lot of considerations on this issue. For example, the ASEAN Comprehensive Recovery Framework, if you look at the pillar on human health, human security, or even the digitalization in the region, the issue of inequality is at the center. So what I should say is that we have the tools, we have the policies, we have some of the interventions, programs, and activity to address this issue. What's next for us is we should take this opportunity to really walk the talk and invest as much as possible so that we don't have these problems again. I think recovering from COVID-19 is one thing, but recovering better and more inclusive should be the aim of all of us here. It's going to be a major challenge for us. But I think, if we leave some proportion of our population behind, and when we are in a crisis like this, we can see clearly that, not everyone will be better off. Actually, all of us is worse off. So again, what I hope for is that, since we are now putting a very robust, plan to address not just the pandemic or all the impacts that the pandemic has, caused, but also doing it in ways that will not, leave anyone behind. And let's invest more in this regard. And in my, keynote address, I'm talking about the universal health coverage as well. There's been some progress on that, but we can still see some room for us to do more, especially when it comes to quality healthcare. Especially when it comes to the access of those who may not be able to have the resources to do so. So a national systems or even a regional framework to make sure that this kind of services can be accessible to as many people as possible should be our way forward. So again, let's do more, invest in this key initiative to recover not just better but also wider as well.
Thank you very much, Prof. The next question is, in your opinion, have ASEAN states utilized its famed multilateralism to overcome the pandemic? Is faction nationalism a concern for you?
Well, it's a very important question. Actually, I can confidently say that we are depending pretty much on this multilateral cooperation to fight the pandemic. When we received the notifications that there's this pandemic at the end of 2019, ASEAN member state convened quickly a wide range of platforms and involve, experts and policymakers from different parts of the world to start talking about how can we contain this. Even for there was a major surge in the region back in January, February, and March, and after that we can see, a number of surges going on in the region. So we have, expert panels together with our colleagues from China, from Japan, from Korea, from the EU, from the US, and also working very closely with international organizations like WHO, UNICEF, and so on. So I can say is that we actually depend pretty much on that, to overcome the pandemic, at least the first part of the experience that we have with the pandemic, and it proved that it's very successful. Now, when it comes to vaccines, I think because of the shortage of the vaccines, and another thing is that the pandemic also hit hard on countries that are producing vaccines, and we are facing a severe shortage of vaccines here in the regions. There are different modalities on how countries are procuring vaccines and so on, but in terms of ASEAN as a whole, we have the framework that would allow the ASEAN member states to work together to procure vaccine. A number of mechanisms have also been put in place, for example, the COVID-19 Response Fund, the Regional Reserve for Medical Supplies, and so on. But all of these interventions are created in time of crisis like this, so it requires time for it to really, serve its purpose. But it proves that it's, delivering some of the positive development for the ASEAN member state. We can also see that there's a lot of sharing going on among the ASEAN member state, especially for countries that have some surplus. Then they also provide this to other member states. But then again, I think going forward, we need to have even more stronger and more comprehensive, framework that will allow the ASEAN member state to procure all of these vaccines together. This way, we can do it in a cheaper manner and can secure a larger bulk of vaccines as well, which is some things that we are still, in the process of trying to do more. To say is that we are reaching the levels that we can, satisfies the needs of all the ASEAN member states in terms of procuring enough vaccine to vaccinate people. I think it's still, some way for us to continue to go forward. But I think we have the framework already, and I believe that for ASEAN as a regional body, and also a very successful regional bodies as well, multilateralisms in securing vaccine should be some things that we need to do. I want to also highlight that in addition to procuring vaccines, our member states are working hard to build the manufacturing basis in the ASEAN regions as well. You see that in Indonesia, in Singapore, in Thailand, in Vietnam, for example. And I hope that, with this strong manufacturing basis in the ASEAN region, in terms of, vaccine security and availability, we may have, some positive progress on that, and especially to make sure that it's not just, to provide and support ASEAN member state, but also some other countries who are in need outside the region as well. I believe that ASEAN can play that leading role in supporting, the region and also the world in recovering from this COVID-19 through our, expertise, our knowledge, and also our strength in multilateral platforms and cooperation and engagement. So again, I'm very confident that we are going in the right direction. It's just that we need to, make sure that all of these multilateral platforms or framework receive enough attention, energy, and resources, so that we can do a lot more than we are now achieving.
Thank you very much, Your Excellency. The next question is, in what ways has the COVID-19 pandemic hampered the efforts made towards building an ASEAN socio-cultural community?
Well, this is similar to the issue of inequality, right? I think we had a lot of conversations whether we are on track in achieving all of the targets and visions that we set out in our work plan and the blueprint, and also the vision. What I can say is that the picture is not very optimistic. A lot of indications shows that we are lagging behind on some of those. especially when it comes to the issue of inequalities, the issues of vulnerable population and so on. So of course, it's affecting us in terms of getting closer to our goal, and not just for the goals that we set out in the work plans or the vision or the blueprint, but also our commitment to achieve the SDG by 2030 as well. There are some mitigating policies that we put in place. You can see that there's a lot of discussions over the past 2 years how COVID-19 is affecting all the sectors under the ASEC. We have 50. We have 15 sectors, by the way. And in the coming year, there will be a more robust studies on this. It's a collaboration between the universities in the UK and in the regions to look at the real impact of COVID-19, and especially to get all the data. Of course, we are saying that there's a lot of impact of COVID-19 on all of these sectors, but at the end of the day, I think it's very important for us to obtain all of this data so that we can tailor the policies in a ways that would allow us to address the problems as effectively as possible. The challenges ahead of us are great, but I think it's similar to my previous intervention, is that it's now time for us to work together, not just between ASEAN and other partner, but also among ASEAN member states as well. I think we owe each other in terms of how can we support one another to get out of this and a pandemic, and also to develop in the next phase of our journey in a ways that we make sure that everyone will benefit from our regional project, the community building process, and so on. It's going to require a lot of resources, and it's not just something to do with the livelihood of the people. We have to also double down on our environment related matters as well. Over the past year, we have done a number of things to mitigate and address environmental issues. Climate change is also on top of the agenda. I'm glad that now we have the ASEAN Green Initiative. The state of climate change report will also be out very soon. A lot of recommendations, a lot of policy ideas there. So I encourage the member state, to take up as many of these recommendations as possible. These are very hard and difficult, policy recommendations, but it is some things that we need to work on, and also for our partner to continue to support ASEAN member state in providing resources. I think chip credit is also something we are looking at, to help the member state to move as quickly as possible on the sustainability agenda. And, perhaps if I can conclude on this particular question, is that going forward, I think ASEAN may also need to have an ASEAN Green Deal or some sort that would allow us to address this problem in a more comprehensive and coherent manner as well, instead of doing it in a separate ways like what we are doing now.
Thank you very much, Your Excellency. The next question is, the pandemic has resulted in unprecedented disruption in labor supply chain in ASEAN, as well as affected the employment of many within ASEAN member states. How does the ASEAN Comprehensive Recovery Framework plan to address the labor issue caused by the pandemic?
Mm-hmm. If I can, say it is the labor sector that is affected, the most by this pandemic, especially the sectors that are, bearing the brunt of this pandemic. For example, hospitality, tourism, even, to a larger extent, manufacturing and so on. So we see a huge number of, workers have been laid off. We are still assessing, the real impact of the COVID-19 on the labor sector. Perhaps, let me discuss these questions from three important perspectives here. I think the first one is how we are going to support the private sector so that they can continue to retain all of these employments. I think in a difficult situation like this, the quicker things that a company can do is to lay off people, right? Or to scale down the business and so on. And I can see that through the stimulus packages that the ASEAN member state, have put out, there's a lot of room for the private sector to access to all of this budget and to continue to operate and retain all of this employment, but also taking the opportunity to reskill or upskill the workers so that all of these people can be ready for the future of work. Of course, I think laying is easy, but getting the kind of person who have all the skills and experience and so on is going to be very difficult for these companies as well. So if there are any support that will allow them to do it, then they can also, work well in terms of, trying to find the solution so that they can continue to keep the employment at the level that is, helpful for the people who are affected by the COVID-19. The second area is, the kind of support that we can provide to our workers. I know there's a lot of schemes that are happening at the moment at the national level. At the regional level, we don't want to say that this is the only scheme that you need to use, and also that depends on the capacity and capability of the ASEAN member state as well, right? So some manage to provide direct cash transfer or some sort of unemployment benefits, providing healthcare services and so on, or some other subsidies and so on to lessen the burden or to ease the pain, from the impact of COVID-19. And on this matter, there are some initiatives going on at the moment. If I could say, for example, on the portability of social security across the ASEAN region for migrant workers. And again, for migrant workers, they are also, affected heavily by this pandemics as well. Many of them are traveling around, doing job on a short-term contract. They don't normally have a very, robust, social safety systems to support them and so on. And now with the COVID-19, they need to return to the home country, the seek medical support and so on. So there's a lot of problems that are happening for our migrant workers as well. So we are now also working on how we can ensure effective return of the migrant workers and also the portability of all of the social security scheme so that our workers can get some sort of support during a time of crisis like this. Of course, prior to the COVID-19, we have some issues already, but those issues have been, properly addressed by the ASEAN member state. We put in place a number of framework that allow member states to work together to address them and to support them as much as possible and reintegrating them into the labor market, the local labor market, and so on when they return from other countries. To work at home because of the lack of jobs or the health situation in other country and so on. So looking at ways on how governments and the private sector can work together to provide the kind of skills that would support them, after the pandemic is over. I don't think it's not just about the pandemic or the fourth industrial revolution. There's a lot of talk about green jobs, green economy, circular economy, decarbonized economy, and so on. So a lot of uncertainty for them even prior to the COVID-19. But it's just that now we have this COVID-19. I think we should also concentrate our thinking, attention, and resources on how we can prepare them for that next stage as well. As we are growing out of this COVID-19, I would expect there will be some restructuring in terms of the economic systems that we have, and there will be a lot of focus on the use of technologies and also the moving, toward a more of a circular economy and so on. So those are the areas that we should, also think about, not just, narrowly on the pandemic, but use this as an opportunity, to do something better. I hope that, we are not trying to address the problem in the short terms, trying to recover from this as quickly as possible, but still, leave behind some sort of problems that we need to address in the future. So these are, the 3 points that I'd like to bring into this discussion. Of course, there's a lot more going on at the sectoral body levels as well on how each country has been doing to assist workers in time of crisis like this.
Thank you very much, Your Excellency. This marks the end of the keynote address. Please join me in thanking His Excellency Dr. Kung Phuoc once again for the very engaging speech.